Welcome to this episode of Healthy Conversations, brought to you by Athens Limestone Hospital, where we talk with local healthcare experts about the topics that matter most to your health and your family. I'm Susan Claiborne, and today we're joined by Courtney Ennis, RN Director of the Emergency Department at Athens Limestone Hospital. We're breaking down the question that comes up for many families: should I go to the urgent care or the ER? Knowing the difference can help you make the right call when every minute counts. Courtney's here to walk us through when to seek emergency care, when urgent care might be the better option, and how our healthcare system works together to make sure patients get the right care at the right time. Hey, Courtney, thank you for being here today. And I know it was a lot to get out of the emergency department. There's never a good time to get away from your office, but we appreciate you being here to talk to us about this today. But kind of as we get started, can you kind of introduce yourself a little and kind of maybe tell everybody kind of why you choose to work in the emergency department?
My name is Courtney Ennis. As you said, I'm the director of Athens Limestone Emergency Department. I have been a nurse for about 13 years, and 12 of those have been in the ER. And I fell in love with the ER as a new grad. I loved kind of the chaos, how no day is ever the same, and then just really being a part of the care that patients provide, trying to solve the puzzle, for lack of a better word, when patients come to the ER, what's going on and how can we help them and provide the best care.
Well, I know we're glad to have you over there, and you're right. It's always chaotic over there, so I'm glad somebody likes that kind of contained chaos.
Controlled chaos.
Controlled chaos.
That's what we call it.
Yeah, there you go. But what we're going to talk about today is kind of like the ER and urgent care, because urgent care is kind of something kind of new or newer. We've had emergency care for a long, long time, but urgent care kind of came along several years ago and then, of course, became more important through COVID for people to be able to go and get tested and things like that. But I know sometimes it's real confusing. So kind of explain to us what the difference is between the emergency care and urgent care. What's kind of your main differences?
Sure. So one of the main differences in the ER versus urgent care is obviously that we're there for life-saving emergencies. So think chest pain, shortness of breath, stroke-like symptoms where, a patient is confused. We're really there to figure out those acute healthcare emergencies. Urgent cares are great, and we're so grateful to have so many in our community, and they help with the smaller, less emergent issues. So as far as like minor lacerations, earaches, sore throats, really where we saw the most benefit from urgent cares was during COVID, because they helped us so much with just the testing. The tests were taking days to come back, and people were just kind of inundating the ER, and we weren't able to get to those really super sick patients. So the differences between the ER and urgent care is that we're definitely there to intervene on those life-saving emergencies, and then the urgent cares kind of take care of the smaller things that we could do in the ER, but then they take away the resources from what we really need to be doing, which is taking care of those critical patients.
I like the way you use the word life-saving, because I know that's kind of important. Like when I've talked to my family and friends and stuff about ER versus urgent care, sometimes is the emergency department is not necessarily there to provide, I guess, treatment to those chronic illnesses. They're to stabilize till you can get to your physician for maybe a change in your medication or some additional testing or things like that. Is that?
Exactly. And I think a lot of people misunderstand that the ER, we're not always there to solve every problem. So like you said, chronic issues that people have going on, changes in blood pressure medications. If you're in a hypertensive crisis, we absolutely want to address that very quickly, because, that could worsen and the patient could deteriorate very quickly. But we're not necessarily there to just change your home medication. What we do in the ER is we address that high blood pressure. We address maybe some symptoms you're having associated with it. And then perhaps we have to transfer you to another facility, admit you to the hospital, and then kind of the inpatient team, they kind of pick up the baton and they carry it forward. And I know that can be frustrating for patients. Sometimes they want everything wrapped up and diagnosed with a bow of, hey, we know exactly what's going on and here's why. But to do that can take days sometimes in an inpatient setting. So you come in with chest pain. We rule out you're not having a heart attack. That's our job. And we rule out some other things that might be causing that chest pain. But sometimes we don't have an answer for the patient in that moment. So we send you to cardiology for follow-up. Sometimes we admit you for labs over 24 hours to kind of track and trend what your labs and EKGs are doing. We're really just there to say, are you having a heart attack right now? Because we want to get you where you need to go to get that treatment to resolve that problem. And then sometimes we kind of have to let the other units and other nursing staff and doctors take care of kind of the other things that are going on.
Yeah. Can you talk about some of those, it says like gray area symptoms like chest pains or high fevers when someone knows, when should someone come into the ER at that point? Is there like a line that you would tell people?
I wish it was that easy.
Right. If only.
Yes, and like you said, it is very gray because, you know, if you've ever had, you know, indigestion pain can be pretty painful and it can feel absolutely like you're, you know, having a heart attack, and it's scary and frightening for a patient. So I think the most important thing for people to remember is just trust your gut. We're always there. You know, even if it's just indigestion and maybe you just, you know, ate too much spicy food, we'll help you with that, but we also want to make sure that it's not, you know, a heart attack or something like that going on. So anything from abdominal pain, that could be something simple, but it could be something, you know, acute as well. Chest pain's a good one. High fevers. Fevers are hard because parents will try to dose at home, but then if they're not dosing appropriately, and that's where the ER comes in as well. Sometimes it's about education. I know in my personal life, I have a lot of friends and moms that are, I'm giving them Tylenol, I'm giving them Motrin, but their fever keeps getting worse, and sometimes it's just a dosing thing. So we have resources in the ER to not only treat the child, maybe do a respiratory swab to rule out kind of those common respiratory illnesses, but then when you leave, we're going to show you, hey, here's a dosing chart that you can use that might actually help relieve the symptoms a little bit better. And then, of course, you know, educating on tepid baths, things like that to help cool the child down. So we're also there to kind of provide that education when you're terrified and you just don't know why your baby doesn't feel good and you just want that answer.
Yeah, I think one of the scariest things is as a parent is that very first time you got to take your baby to the ER.
Yes, absolutely. And we get a lot of scared moms. I was an OB nurse kind of while I was an ER nurse. So, you know, there's a lot of just unknowns. And when you don't know, where do you go? You probably go to the hospital or you go to the doctor, and the doctors aren't open. So then you come to the ER. And so, you know, we're always there to help.
And sometimes people wait too long to come to the ER or wait longer than they need to come to the ER for, I guess, different reasons.
They are. I do think that I think our community is very blessed that we have so many physician clinics around that kind of help us with getting patients in for that primary care. One of the most important things people can do is get primary care because that helps get ahead of things before they worsen. And we're lucky that we have so many clinics and things like that around. And then sometimes just waiting out of, I know me personally, pure stubbornness. Sometimes I'm just like, it's fine. And then until it's not fine. So just always reaching out. We're always there. There's a lot of insurance companies that also offer telephone triage, things like that. And then, like I said, we're always there to just make you feel better sometimes.
Yeah.
Assure you that it's not life-threatening.
What would you, how would you describe maybe behind the scenes of the ER to help people understand maybe why things don't happen as quickly as they want in an ER? What is kind of the process behind it when you get a patient?
Sure. So we triage patients. So every patient that comes into the ER is triaged. And that triage really is a sorting game. I hate to use the word prioritize because that kind of has a negative connotation, but really that's what we're doing. We're looking at 10 different patients who needs us the fastest, whose illness is so critical that we need to intervene the fastest. And that's really what the triage process does. I won't go into the too many details of ESI level 5 and things like that, but that's what we're doing. We're looking at who's critical, who needs life-saving intervention, and then we kind of go down, really it is an algorithm of life-saving interventions and then critical where they could deteriorate quickly, that they could, need those life-saving interventions. And then really after that, we're looking at resources. Resources are labs, x-rays, medications, things like that. And then we kind of sort that way. So we have a prime care area, which is sometimes where we'll put what we call our lower acuity patients. Sometimes it's something as simple as like a broken arm. So really you need an x-ray and a splint. Sometimes it's a sore throat. You need a throat swab, maybe some medications, but really probably just prescriptions and manage the symptoms at home. And we do try to get those patients through our ER faster by using that prime care area. And then, the frustrating part for people will be that they see someone come in after them that may have a lower acuity illness where they've been waiting longer, and more than likely they're going to that prime care area just because those patients turn over a little bit quicker. But that probably is one of the biggest complaints and issues that I get from patients is kind of that first come, first serve. We're not first come, first serve. I wish that we were, wish that we had the space to be that way, but we really do have to prioritize those patients and bring back the sickest fastest, so that way we can intervene and get them taken care of. And then we do try to open up that prime care area to help get those lower acuity patients through faster as well.
Right. Of course, everyone, won't really understand that until if they were unfortunately in that situation, right? And then they would be glad it was that way.
Yes.
If they had a more pressing issue that needed to be seen. And I know it's hard even as a new mom myself. I'm sure if my son had a broken arm, I would feel like that should be the most important thing in the room.
Yes.
Why is everyone not
It is for you, absolutely.
It's
Yes.
most important. When you have to step back and look at the bigger picture, I know that has to be hard to kind of separate, and even maybe the emotions behind that of just having to understand that we have to get to these people first.
Yes.
And, I'm sure that's a tough job to have to.
It is. And we're lucky that a lot of our urgent cares offer like simple x-rays like that. So I can't speak for all of them, but I know there's some that will actually do those x-rays and stuff like that. So I do think that it's important that community and people know what the resources are around them. It may be even calling an urgent care saying, hey, I just need to know, like, can you x-ray the arm? Because we certainly don't want you to waste your time. If you have to come to us, come to us. Again, we're always open. But just knowing what those resources are, because number one, you save yourself probably some time, and then you get your child treated quicker, and I'm sure they provide excellent care there as well.
Yeah, and for some of those things like the broken, I know in the future we're going to have somebody on with TOC to talk about their new TOC urgent care, which is kind of for those, I guess, broken things that kind of happen during normal hours where a lot of times you need to go see the orthopedist to fix it, but you don't have an appointment. So I know we'll have them on to kind of talk about those things too. But years ago, obviously before urgent cares really, I know my daughter fell and like busted her chin open, had to have stitches, and it was like the weekend, so we had to go to the emergency room. But now that's something that we could have taken her to an urgent care just to kind of get that stitched up and cleaned up and
Absolutely.
antibiotics or whatever she needed. But I know that would have been extremely helpful because we were one of those parents sitting in the emergency room with a screaming child who's gushing blood from her chin, and you're not life-threatening, although it feels like it does. When your child is just screaming their head off and hurting and not understanding. And so I know it is grateful to have urgent cares for some of those options, but it can be hard to kind of make those decisions. So one of the things you always hear, you can't avoid it with the ER, is a wait. So what are some of the reasons that the wait time is so long sometimes? And I know I had the opportunity to read Google reviews. So you've got those people who come through and they're like, hey, we were in and out in an hour and a half and they did so great. And then there's those who we were there for 6 hours, etc. So what are some of the kind of behind the scene reasons of why ERs all have long waits?
Yeah, I mean, we always strive to be efficient. Efficiency is important, but we also, more importantly, want to be safe. So a lot of times when we have some of those issues, we're always looking at processes, how we're doing things. Sometimes we have a process at our ER where we will actually see patients out of the lobby. Maybe after they've been medically screened, we'll get blood work, things like that. And that just kind of helps us get some diagnostics before they actually get back to a room. But one of the main reasons people wait is just simply because we have more patients than we have beds for. And if we have, one critical patient can take multiple clinical staff members to include doctors, nurses, lab techs, x-ray techs. All of those people are involved in that patient's care. And when you have a very critical patient or two critical patients, then that really just eats into your resources. And obviously, like I said, we want to get those people back quickest and fastest because they need us the most. And so a lot of times really it has to do with just the number of patients that we have and how many beds we have available. We'll try to, put people in what we call a seated treatment area when we can, but that's again one of those things that it depends on the resources that we have available.
And there's a lot of that testing that sometimes just takes time. So even once you get somebody back, it can be a while before you get results back from imaging or the lab?
It can take upwards of probably once we've done most of our diagnostic testing, you're looking at about 2 hours for us to get all of your lab work, all of your radiology. That includes the time it takes us to draw the lab, send it to the lab, have them run it, radiology to come get you, take you to radiology, get your scans done, bring you back to the room, and then get those read. And then, and we're looking at multiple patients. So, we want the doctor to be able to focus solely on you. So when those results come back, they look at your case and then decide treatment from there.
And that's 2 hours considering there wasn't somebody else already in front of you
Yes.
getting
Yes.
multiple
That's
imaging
from the
things
start
also.
clock. Yes,
Yeah,
yes.
yeah. Well, and that does explain it because, you get back in the patient room and you have your scan done and you just think you're just waiting on results and you wonder why 2 hours later you're still waiting on results. So,
And it can be frustrating for patients just not knowing what we're doing. But there's always something going on behind the scenes. And I think that's what people don't understand, that there's something going on. Sometimes it is just waiting for the lab to run those tests. Some of our tests take longer than others. Some of them are quicker. So it's just getting all those puzzle pieces put together so that we can get the patient taken care of.
well, I know it's been decades. It's always been how long is the wait at the ER? How busy is the ER? So it's not a problem that's going away. But like you said, there is a continuous benefit to looking and seeing what things can be done quicker or more efficient and to try to speed that along. So I know we appreciate that. That's there for us. What do you wish if you could explain to people about the ER, about misconceptions or things that are misunderstood? Anything that I know you get all the questions. I know friends, family, on top of patients.
I think one of the biggest misconceptions is that the ER is not always the fastest option. Like I spoke, we had the benefit of a lot of those urgent cares that sometimes are seeing those less critical patients, so they're able to get you through the system faster. I also think it's another misconception people have is that they're not being treated on a first come first serve basis. If I had probably one complaint that I get more than anything, it's that somebody went in front of me. Somebody, they came in after me and they got treated before me and here I sit. And that is very frustrating and I absolutely can understand their frustration with that. But again, we're looking at the most critical patients first. And then we go through that algorithm that we use to try to make it as fair is not a great word, but as fair as we can, using that clinical data, using our resource data to decide where that patient needs to go. And then I think the last one would be that we don't always know the answer when you leave. So whether leaving be transferring you to another facility or maybe admitting you to the hospital or sometimes discharging you with follow-up instructions, we may not be able to answer exactly why you're having those issues, but we do always want our patients to leave with the knowledge that they can always come back. I think the one thing we always tell them is if it gets worse, you always come back. Worst case scenario, we repeat it again and it's all the same, but it still gives you that peace of mind that, it hasn't gotten worse. But then also following up with your primary care, following up with cardiology, different specialists that we have to help you find those answers. Because nobody wants to feel bad. Nobody wants to leave the ER feeling bad. And we never want you to leave the ER feeling bad. But sometimes those things are just outside the realm of what we could provide in order to continue providing services for all the other patients that are probably waiting in the lobby still.
Yeah. Yeah, no magic pill, no magic Band-Aid sometimes. Yeah,
Yeah.
And that goes back to what was said at the beginning. The ER is for that life-saving, and sometimes once somebody is stabilized, it is more of a follow-up with your physician to see why you're continuing to get headaches or why your sugar dropped or, whatever those reasons are. So I can understand that. And I love when you said that about the fast, for years, ERs were marketing against each other, as the faster
wait time,
ER,
yeah.
faster wait time and stuff, and kind of didn't do ourselves a lot of good promoting that, I guess. So what's your advice to someone who isn't sure where to go? Like they don't want to make that wrong call, but they're not real sure whether they need to go to urgent care or whether they need to go to the ER. I know you can't give definitives.
I'm not going to give any medical advice out, but
just a little.
absolutely. I think the most important thing is always trust your gut. like I said, I've hoped I've said it multiple times. We're always there. Our doors are always open. We don't ever close, and we always have a spot to treat you. So if you're not sure, sometimes it's just reassurance that you need, and you may have to wait a little bit before we can give you that reassurance. But we're always there. There's different resources you can always call. Your insurance company might have a telehealth nurse, but if you have nothing and you just want to make sure, you just want to know what's going on, we're always there to help you. And hopefully at least maybe not give you an answer, but hopefully get you on the path to where you can get those answers if we're not able to answer it for you.
Well, and I love that you pointed out those options like telehealth, because I know a lot of insurance companies do offer that. And I know I've used that before, especially when you kind of know there's certain things going around, you know, everybody's kind of having the same kind of illness go on and that kind of thing. Sometimes that telehealth, when you already kind of have an idea of what's probably existing. So those are great options that, you know, medicine has been able to incorporate
Yes.
into 24/7 healthcare,
Yeah.
I guess you'd say. When before the only 24/7 was
What's the ER?
Yes. And it's still
We
the
still
ER,
are, but there's
24/7.
there's
Still
resources to help support us, and
still
so that
force.
And so, working in the ER, I know you're saying you were talking about the triage process and how difficult it can be to have to tell people that, you know, maybe I know you were here first, but, you know, we have to see other people. How do you stay positive on the hard days when you're in the ER?
Oh, I think, you know, ER nurses and ER staff, hospital staff, we have bad days. Everybody has bad days. You know, I think the question that we all hate the most is, what's the worst thing you've ever seen? People ask that question. It's like, I don't want to talk about that with you because I don't want to go back to that day. But I do think that, you know, all of us have a heart for caring for people. That's why I went to nursing school. I know that's why, you know, we wake up every day and we do those 12-hour shifts that are hard, and you take care of people, and you don't always make them happy, because telling someone they have to wait another 2 hours is not going to make them happy at all. So I think we really just rely on each other as a team. I know my team in the ER, we rely on each other when we have those bad days, and we just kind of support each other through that. And you know, when we're met with rudeness, we just try to meet it with kindness, because at the end of the day, that person is just probably either scared, they don't feel good. Nobody wants to be in the ER. You know, you'd rather be at home in your bed if you could be there, but you're, you know, here with us. And so I think that it's just trying to remember that it's not personal. It's just, you know, that person is going through whatever's going on their end, and we just have to be sensitive to that and be able to hopefully de-escalate the situation and explain to them that, you know, this is how our process is, and we're sorry for that wait. We always are, but the reality is that sometimes people have to wait.
Yeah. And choosing back to the choosing the right healthcare, whether it's the urgent care or the hospital, I guess has a benefit for both the patient and the healthcare system as a whole.
It does.
Because I don't think people realize how expensive care is in the emergency room versus that care at the urgent care or at the clinics and things like that. There's a huge difference in what the cost of that care is, which the emergency rooms here, regardless of the cost, but it does utilize resources that could be used for, or not could be, but it utilizes resources of the emergency department versus for things that can be cared for outside of the emergency department. I guess y'all kind of have to deal with that on a business end.
Yes, we have to manage those costs, of course. You know, the low acuity patients, those eat up resources too, but then you get those critical patients, and they're going to eat up a ton of resources. And so, you know, like you said, we're always here despite the cost and a patient's ability to pay, but there is urgent care, their overhead's just less expensive than ours are, just
Right.
because we're looking at, you know, doctors, nurses, radiologists, all the things we're looking at that we have to keep there and that are involved in your care. And so that does kind of change the cost as well.
Yeah. And of course, choosing the right care sometimes can make it quicker and make it more convenient for the patient. If urgent care may be quicker and easier for the patient, so versus the ER.
Yeah.
Yeah. So what would you say? I know sometimes it is hard to come to the ER. Patients don't want to come. They don't want to wait. They're afraid they're going to get sick. Maybe they feel like they can't afford it. Maybe they're not real sure they want to be don't want to be embarrassed about coming to the ER for something that really wasn't an emergency. So kind of what do you say to patients who do feel that way?
I would say, again, just trust your gut. If you think you need us, come see us. We're happy to help. We're always there to provide that care for you. Don't be embarrassed. I mean, I think that people have a misconception that we won't treat them with the same kindness that we would anybody else. And that is absolutely a misconception. We will treat you, even if it's something simple and doesn't, you feel like that maybe you could have gone to an urgent care and you came to us instead. That's fine. We're still here to help you. So, always just trust your gut. If you want to come see us, if you need to come see us, not if you want to, if you need to come see us, then absolutely come see us and we'll be there to provide that care for you. And even if it is something simple, I've, had some very, very simple patients that probably, didn't need to come to us, but it doesn't really matter. The staff, they come to work to care for people. And even if it's something that might be silly or maybe was an unnecessary visit, in our minds, it still felt necessary to the patient. And that's what we have, we remember it and we take care of them just like we would a patient going through, something critical that needs us in that moment.
Yeah. And that definitely goes back. Your first ER visit sometimes is very difficult. And if it's a child, it's scary as a parent when you're trying to make those decisions on whether to bring your child into the ER or not. So.
And kids are always afraid. They come to the hospital. They're, my kids love to play doctor, but you bring them to the hospital, they're like, whoa, there's people in scrubs and things like that. So, we try to make sure they're comfortable. And then really it is about sometimes consoling the parent more than it is the child because I know me as a mother, I'm probably more upset when you try to, give my kid a shot than my kid's going to be, but that's my baby. So sometimes it's consoling both of them and making sure that we're making the child feel better and also reassuring the parent that you did the right thing and we're going to take care of your baby. So
I understand that. As I said earlier, I see the Google scores when they come through and we really do have some great people working in the ER and it shows with the comments that come through. There's always going to be some negative and usually it's because, if you come into the ER, you're pretty much having your most rotten day. Mm-hmm. And if you're waiting, you're definitely feeling that, in addition to how you were already feeling when you got there. But even above that, we are receiving so many great reviews from Google Review because y'all really do a great job over there.
Yes, the staff really care. They care about our patients. And they really want to provide that top-notch care. Sometimes we can't do it as fast as we would like to, but they really take pride in the care that they provide and how they care for this community. And I'm very proud of them and all the heart that they put into what they do every day.
That's awesome. Yeah, I've really enjoyed learning more about the ER. If people were to take away one thing from the conversation today, what would you say that one thing should be?
That we're always there to help. Even if it's something simple or something complex, the ER is always open. We're always here to help. And we'll be there to help, hopefully, for a really long time.
Thank you.
Thank you.
Thank you for joining us for this episode of Healthy Conversations. And a big thank you to Courtney Ennis for helping us better understand when to use the ER, when urgent care is appropriate, and how to make confident choices when a health issue arises. Knowing where to go and when can save time, reduce stress, and even save lives. Be sure to follow Athens Limestone Hospital on social media and subscribe to Healthy Conversations for more helpful conversations with the people who care for our community. Until next time, I'm Susan Claiborne with Karina Farr. Thanks for being part of the conversation.